Hello everyone. So in this video we will start solving questions from Dental Pulse from the subject Pedodontics, and we will start with chapter 1, Child Psychology. So let's begin. Question 1 is, hand over mouth exercise home is effective behavioral modification technique in the age group of. So the answer is option A, 3 to 6 years. Hand over mouth exercise is effective behavioral modification technique in the age group of 3 to 6 years. Explanation is, hand over mouth exercise is the behavioral modification method of aversive conditioning. Its indications are 3 to 6 years, a child who can understand simple verbal commands, children displaying uncontrollable behavior, healthy child displaying uncontrollable behavior. Contraindications are child under 3 years of age, handicapped, immature or frightened child, or the child who is physically, mentally and emotionally handicapped. Okay, another question on the same topic. Home technique is used to. So the answer is intercept tantrums of an otherwise normal child. Okay, now question 2. According to Frankel behavior rating scale, a negative child is the one. So the answer is option A, who shows reluctance to accept treatment with some evidence of negative attitude. So this is the Frankel's behavior rating scale. There are 4 types: definitely negative, negative, positive and definitely positive. The definitely negative child refuses treatment, cries forcefully and extremely negative behavior associated with fear. Okay, negative is reluctant to accept treatment and displays evidence of slight negativism. Positive is accepts treatment but during treatment may become uncooperative. And definitely positive is unique behavior, good rapport with the dentist, looks forward to and understands the importance of good preventive care. Another question, according to Frankel classification, negative child is. So the answer is reluctant to accept treatment and displays slight negativism. Okay, now question 3, IQ 25 to 50 is suggestive of. So the answer is option A, imbecile. So explanation is, degree of mental disability. It is mild when, according to Wechsler Intelligence Scale, the score is 55 to 69. And according to Stanford Binet Scale, the score is 52 to 67. And the communication is, child can speak well enough for most communication needs. Okay. When it is called moderate, when the score is 40 to 54 according to Wechsler Intelligence Scale, and it is 36 to 51 according to Stanford Binet Scale, and the child communicates at a basic level with others. When the degree of mental disability is severe or profound, the score is 39 and below according to Wechsler Intelligence Scale. It is 35 and below according to Stanford Binet Scale, and the child is mute or communicates in grunts. The child has little or no skills. Now the classification of intellectual disability. Okay, the child is called idiot when the IQ is less than 25, imbecile when the IQ is between 25 to 50, moron when the IQ is 50 to 70. Okay. Now question 4, paradoxical excitation in children is caused by. So the answer is barbiturate. Paradoxical excitation in children is caused by barbiturates. Barbiturates may cause paradoxical hyperexcitability rather than sedation in some children. Nitrous oxide causes diffusion hypoxia when the sedation is reversed at the end of the procedure. This can be prevented by maintaining 100% oxygen for 5 to 10 minutes after sedation procedure. Ketamine produces dissociative type of anesthesia in children. Okay. Now question 5, N2O more than 30 to 40% causes. So the answer is option C, amnesia. The dose of 40% nitrous oxide plus 60% oxygen is commonly used for N2O conscious sedation. 5 to 25% nitrous oxide causes moderate sedation, diminution of fear and anxiety, marked relaxation. 25 to 45% nitrous oxide causes dissociation, sedation and analgesia, floating sensation, reducing blink rate, euphoric state, and this concentration of nitrous oxide is also known as laughing gas. 45 to 65% nitrous oxide causes total anesthesia, analgesia is complete, and marked amnesia. Okay. Now question 6. Fear is. So its answer is option A. A primary emotion acquires soon after birth. So fear is a primary reaction due to known danger, while anxiety is a reaction to unknown danger. Types of fear: innate fear, without stimuli or previous experience; subjective fear, fears transmitted, suggested to the individual by family, friends, etc. Objective fear, fears due to own experience and direct stimulation of sense organs. Best method of communicating with a fearful deaf child: use of euphemisms, word substitutes, or reframing. Basic fear of a 2-year-old child during his first visit to the dentist is related to fear of separation from parent. Type of fear in 6-year-old child in dentistry is subjective fear. Type of fear is the most usually difficult to overcome. Long-standing subjective fears. The best way to help a frightened child to overcome his fear. Identification of the fear is the best way to help a frightened child to overcome his fear. Effective methods for the management of fears are reconditioning, explanation, and reassurance. The 4-year-old child who is aggressive in his behavior in the dental stress situation is usually manifesting a child patient demonstrating resistance in the dental office is usually manifesting, so it's anxiety. Now question 7. In intellectual deficiency syndrome, the IQ is in the range of, the options are 75 to 90, option B 50 to 75, option C 45 to 50, or option D 90 to 110. So the answer is option B 50 to 75. Explanation देख लेते हैं. Intellectual disability, cognitive disability, or previously mental retardation is a term used when a person has certain limitations in mental functioning and skills such as communicating, taking care of him or herself, and social skills. These limitations will cause a child to learn and develop more slowly than a typical child. The most common disorders associated with intellectual disability are autism, Down syndrome, Fragile X syndrome, and fetal alcohol spectrum disorder (FASD). Intellectual disability is a below average cognitive ability with characteristics. Intelligent quotient IQ is between 70 to 75 or below. Significant limitation in adaptive behaviors, the ability to adapt and carry on everyday life activities such as self-care, socializing, communicating, etc. Now question 8. Nitrous oxide is contraindicated in option A COPD, option B asthma, option C sickle cell anemia, or option D all of the above. So the answer is option D all of the above. Okay, explanation is contraindications of nitrous oxide sedation: COPD, asthma, respiratory infections, sickle cell anemia. For general anesthesia, all anemias are contraindicated. For GA, all anemias are contraindicated. Otitis media and epilepsy. Okay, so these are the contraindications of nitrous oxide sedation. Question 9. Reinforcement technique is based on. The answer is option C. Reinforcement technique is based on Skinner's theory. Child psychology theories can be classified as psychodynamic theories, and behavioral theories. So in psychodynamic theory, there is psychosexual theory given by Sigmund Freud, psychosocial theory given by Erik Erikson, cognitive theory given by Piaget. Okay, and in behavioral theories, there is hierarchy of needs given by Mesler, social learning theory given by Bandura, classical conditioning theory given by Pavlov, and operant conditioning theory given by Skinner. Okay, now question 10. The aim of the first session with a child patient is to all accept. Option A, establish general communication with the patient and parent. Option B, start restorative procedures. Option C, obtain background information of the child. Or option D, take radiograph. So the aim of the first session with a child patient is all except start restorative procedures. Okay, all three are correct, but we should not start the restorative procedure in the first visit. The aim of the first visit with a child includes the options A, C and D. The treatment should be started in subsequent visits except in acute conditions like abscess, badly carious or painful tooth, etc. Now question 11. In which of the following conditions GA and conscious sedations are not required? Option A is cerebral palsy, option B mental retardation, option C controlled epileptic patient, or option D emotionally unstable and apprehensive. So answer is option C, controlled epileptic patient. In controlled epileptic patient, there is no need of GA and conscious sedation. Let's see the indications of general anesthesia. Patient with physical, mental or medically compromising disability, extremely uncooperative, fearful, anxious or unactive child, patients with extensive trauma requiring surgical procedures, or the patients requiring dental care for whom use of GA reduces the medical risk. Now contraindications of general anesthesia. Those with a medical contraindication to general anesthesia and healthy and cooperative patients with minimal dental needs. Okay. Now question 12. Vidya, a 3-year-old, comes for her pre-dental visit. She is highly intelligent with family members of high IQ. You would do most probably what type of treatment? Option A, radiographs and topical fluoride. Option B, get the patient accustomed to the dental clinic. Option C, employ desensitization. Or option D, employ behavioral modification. So the answer is option B, get the patient accustomed to the dental clinic. Explanation is, the IQ formula used by Binet was the following. IQ is equals to mental age upon chronological age into 100. IQ below 69, the child is mentally retarded. Below 90, low average. 90 to 110, the child is average. Most of the children belong to this age. Above 110, high, average or superior. After Binet test, more than 300 tests have been devised to measure intellectual development, and the best known and best standardized of these tests are Wechsler intelligence scales. Another question on the same topic. Binet IQ formula is, so the answer is mental age divided by chronological age into 100. According to intelligence quotient classification, a score of 120 to 139 is, so the answer is superior. On eruption of deciduous first molar, child shows. Option A, 2 to 3 word sentence formation. Option B, focus on light. Option C, bowel control. Or option D, walking without support. So the answer is option D, walking without support. Explanation is, deciduous first molars erupt between 13 to 18 months of age. The milestones that are achieved by end of 18 months are: imitates others during play, may have temper tantrums, plays pretend, for example talking on a toy phone, may show fear with strangers, uses several single words, points to things he or she wants, the child walks without help, Child scribbles on his or her own, says and shakes head, no. Drinks from a cup and eats with a spoon. The child can keep head erect at the age of 6 to 7 months. He or she can speak 2 to 3 word sentence by the end of 24 months. And bowel and bladder control around 24 to 30 months. Okay. Now question 14. Tell, show, do technique of child management was introduced by. So the answer is Adelson. Tell, show, do technique given by Adelson. Modeling was introduced by Bandura. Desensitization was given by Joseph Wall. Home was given by Jordan. And dental home concept was given by Arthur Novak. Now question 15. Children able to keep his head erect in which age group? So we have studied about it. The children can keep the head erect at the age of 6 to 7 months. Okay. Explanation is, by the end of child's 6 month, the head control and neck muscles are fairly strong. By 6 months, babies can easily hold their heads in erect posture. Okay. Now question 16. A drug which is not used to provide conscious sedation in a child is. Options are nitrous oxide, option B chloral hydrate, option C hydroxyzine, option D lincomycin. So the answer is lincomycin. Let's see explanation. Agents used for sedation in children are gases, N2O plus O2. It is a frequently utilized method. Benzodiazepines, for example diazepam, midazolam. Sedative hypnotics, example barbiturates, chloral hydrate. Narcotics, example meperidine, fentanyl. Antihistamines, hydroxyzine, promethazine, phenergum, chlorpromazine, diphenhydramine. Dissociative agents, ketamine. Example ketamine. Question 17. How is a 2-year-old positioned for an emergency examination of a fractured incisor? So the answer is on the parent's lap. Lap to lap position is the recommended position for performing oral hygiene procedures in 1 to 3 years child. Okay. Question 18. Basic fear of a 2-year-old child during his first visit to the dentist is related to. So the basic fear of a 2-year-old child during his first visit to the dentist is related to fear of separation from parent. Okay. Now question 19. Peer pressure is maximum in. So the answer is option C, teenagers. Peer pressure could show up in the teen's life early, but it will have its maximum impact when the kid enters the teenage years. Question 20. Before sedating a child, it is. Option A, not essential to take the consent. Option B, essential to take the written consent. Option C, needed to consult the pediatrician. Or option D, essential for the parent to be present. So there are two options which are correct. Option B, essential to take written consent, and option D, essential for the parent to be present. So both options are correct, but if we have to take one option, then it is more correct. Okay. Before sedating a normal child, it is important to take informed consent and have the parents present during procedure. A child with previous medical history, however, requires consultation with the child's physician. Okay. So we have done 20 questions in this video. In the next video, we will start from question number 21. If you like the video, please do like and subscribe to the channel. Thank you so much.